Needs assessment of the nuclear medicine department. I'm Marshall Denton, Boise State Imaging Science 412. So we did a needs assessment to investigate the needs of our department and get feedback from coworkers and physicians, supervision, professional, non-professional participants to determine what we needed and the ranking of what we needed in our department. And what we came up with is that we need a gamma camera, dose calibrator, thyroid probe, and communication issues dealt with as far as hospital staff and patient preparation, and registration issues where the patient shows up for their appointment and then delayed or turned away by issues that somehow could have been handled prior to that, but not in control of our department, more of a hospital issue. So we conducted the survey and by questionnaire and brainstorming, interviewing, and we came up with priorities based on the results of the assessment. And the gamma camera ranked number one in the needs, followed by the thyroid probe, the dose calibrator, and of course these other issues with the patient prep and the registration issues. The camera being determined that would help most of all catch up on a backlog and let us do some additional and more innovative studies and tests than we are currently able to do. So we have causes and problems of these issues. With registration, it's the systemic issue that we will need help correcting that outside the department, a hospital-wide solution, whole system approach. The patient prep is just ongoing communication issue, different areas, notifications, reports, not including this info. We were trying to get them to input into the EMR more either software input or modifications so that this will help them along with the communication issue. Thyroid probe unreliable, dose calibrator occasionally not behaving like it's supposed to, and camera that we need is actually close to down at this point. So of course the costs of the equipment would seem prohibitive, but with the assessment and the calculations of revenue and costs recouped, that the calculations might just work out on that, and that's what we're pushing for. So, and these things do take time. That's what our hope is and what we're working on. And as you can see by this chart, the overwhelming opinion is that it is a financially justified expenditure. As I said, the solution to this will be purchase of a new camera and the other equipment as well, and then solving or attempting to solve these communication issues. The follow-up, if these items get approved or the highest priority gets approved, is to get the vendors in, get the rest of the calculations done as far as cost, revenue, the room, inspections, and selecting equipment, getting the equipment installed, proper training, and addressing all the people that are involved with it, get them online, and we can proceed and get the patients in and get the satisfaction up. We've done the questions, we've done the survey, done the evaluations, and we will see if we can get some new equipment out of this. Thank you. We, of course, are striving for higher patient satisfaction and, along with it, physician satisfaction. So if we can get these items and get these solutions going, we can achieve that. I would like to conclude by thanking those that did help us out with the surveys and fact-finding for this endeavor. And these are references that we read to gain some information and insight on how to go about this.